Welcome to the Global Diabetes Insight, the go-to podcast for navigating the world of diabetes. I am Tino, a certified diabetes educator and a global advocate for non-communicable diseases.
And I'm Kona, a global advocate and a medical doctor. Together, we're your hosts, dedicated to raising awareness, fostering open discussions, and creating a safe space for everyone affected by diabetes.
Join us as we dive into important conversations with individuals living with diabetes, caregivers, healthcare professionals, and researchers. Our goal is not only to guide you through effective diabetes management, but also to inspire advocacy for proper healthcare access.
So get ready for a journey of insights, ideas, and diverse perspectives. Let's amplify our collective voice and create positive change. Get involved, get engaged, and join us in creating the change we need. So welcome everybody to Global Diabetes Insights.
So welcome to the Global Diabetes Insights. Previously, I know we called the Diabetic Mogul Podcast, but now we are rechanging or renaming our podcast to Global Diabetes Insights. And I think, Dr. Bob, you're the first guest we have since we changed our name. So maybe if you could kindly introduce yourself to the audience.
Thank you so much for having me, and so pleased to be able to speak with you today. My name's Bob Gabbay, and I'm the Chief Scientific and Medical Officer at the American Diabetes Association.
I'm glad that we got to meet in December 2022 during the IDF conference, and it was just great because our conversations were just mutual. It was just amazing. And then I thought, wow, we needed to have someone like you. And I went on to research to say, find what are the things that you're interested in, so that when we bring you to our podcast, we'd ask you those questions. It would be sort of like an inspiration to people that will be listening to this. I don't know if you could maybe describe a day in the life of the Chief Scientific and Medical Officer for the American Diabetes Association. We are really in awe of the American Diabetes Association, of what it is, what it does. We get so much reference from it, the standards of care that you usually publish, Dr. Paul.
Yes, well, thank you. It is a busy day typically. Just at a high level, it is in any given day, it's a variety of different things, which is sort of particularly wonderful for me because I'm a little bit of an ADD kind of person. And so I get to switch different areas. I have a team that I work with. And so a lot of it is, if you were to watch me, it's unglamorous because I'm literally sitting in a glass box practically at a WeWork on my big screen computer all day. But it's the conversations that I have that make the day interesting and exciting. And so each day is different. Some of it is putting out fires, just running a big organization. There are lots of things that come up, and I would call it really problem solving. There's a piece of it that it's sort of internal within the organization and working with, my team and others, and then also externally with all sorts of different partners. And we have literally dozens of different projects that we're doing, wonderful collaborators from really all parts of the diabetes ecosystem. So it's fun and it's dynamic and busy, and I have to say I love doing it. It's great. I guess what I would also say is what really drives me in all of this is really ultimately trying to have a big impact. One of the great things of being here, what frankly brought me here to the American Diabetes Association, is the opportunity to have, in many ways, a global impact. You mentioned the standards of care that we produce each year. And in fact, we're finalizing that as we speak. So earlier today, I was meeting on specifics around that. There are the globally recognized guidelines for diabetes that really we all use as clinicians to know what to do to keep track of what the evidence is. And as that evidence evolves, be able to evolve the recommendations.
Thank you so much. And yes, if you're a person that is researching or maybe downloading these books, you'd see that, like, since I started in 2020, it's not only applicable to clinicians, but also to people living with diabetes. But because you can get some recommendations, and what are the recommendations? What has worked based on the evidence that you have? So that is just incredible. So thank you for working hard and making sure that you publish them yearly.
Thank you, Tino. And it's a great team that really makes it happen, from the professional volunteers that are, from different sort of professions within the diabetes world to the ADA staff. And it is a remarkable effort. And one of the things we're very mindful of, and we'll be doing more of that this year, is how can we take that large document and distill the important messages, not only for clinicians, but also for people living with diabetes, because we want them and their caregivers to know what to expect and to sometimes guide their clinicians that may have forgotten about doing something or the latest thing, and sort of bring things to their attention.
Dr. Bob, this is amazing. And I believe everybody who's going to watch this will be inspired also to say, fine, okay, even people that didn't know about the standards of care, that they are available to all for free. It's not like any other book, because other things, like especially with the contents that this has, you'd have to pay to read or just to see them. So thank you so much for making it free and available to everybody else.
Not only is the entire document freely available, but there's also a shortened version, an abridged version that's available, and a great app that you can download on a smartphone that allows you to have that handy and be able to look things up very quickly. And so all of those are great resources. And we're developing more and more infographics because, literally a picture is worth 1,000 words. You can just see the recommendations in a very clear and quick way and get it. And that's really what we want to be able to do. We want to see those recommendations actually be implemented, have them happen, so that, because we know that when they do, people with diabetes will be so much better off.
Wow, that is just great. Previously, I know that you focused on innovative models of diabetes care to improve or enhance diabetes outcomes and improve the lives of people with diabetes. Wow, this was so great because you focus more on improving the lives of people with diabetes. I think this was during your time at the Joslin Diabetes Center. So I don't know if you could maybe share with us maybe some of your key learnings during that time.
Thank you. So really it's trying to solve this central problem in diabetes. And here's how I would frame it. We've known for probably 2 decades that if one is able to achieve certain goals, let's say, glucose levels in a healthy range, blood pressure, cholesterol, and early screening for complications. If that happened, the rates of complications would be dramatically lower. In some cases, literally, we could prevent blindness, kidney failure, amputations, and dramatically reduce heart disease. While we've known this for a while, and we've had better and better tools to achieve that over the last decade, you just think of the number of the technology that's changed, the medications, new medications that have become available. Let's say, as an example, in the United States, what percentage of people living with diabetes have their A1C blood pressure and cholesterol in the healthy range? It's less than 25%. Why is the idea? It's not bad doctors and it's not bad people. It's the system of care is not well designed to get the outcomes that one needs. And so that's what's really gotten me interested in how can we innovate those models of care to achieve the outcomes we know can be achieved and spread that for everybody.
And I could think of a point that we usually talk about in the diabetes community. And also, I know healthcare professionals also emphasize on it to say one size fits all is not a solution. And trying to base the treatment of people individually is just amazing.
That's critically important. And I teach as well. And, when I'm with junior colleagues, and they're thinking of careers, and they often say, like, all you do is diabetes. Isn't it like the same, like patient after patient? And I'm like, no, because every person with diabetes is different. Understanding their life is really the key to helping them do better. And that's probably more true for diabetes than any other chronic disease I can think of, that it is so much a part of your life, for you need to understand the person's life to be able to help them.
Me, myself, as a person living with diabetes for 13 years, and as a person who has been exposed and attending conferences, extraordinary conferences, and also as a certified diabetes educator, I thought maybe I could try to change something, because I know medical healthcare professionals from my context, they do not have these opportunities to attend conferences and learn about these things. Everything is generalized here. So this is the things that I'm also trying to help change, learning from people like you. I think this is amazing. So thank you so much, Dr. Bob.
You just got me thinking of when you asked sort of an example of innovative care models. So one of the things we know is that where care is delivered by a team, people do better. And every member of the team has value and they provide that. And so depending on the environment you're in, you may not have access. Most people don't have access to endocrinologists. You may not have a primary care physician. It may be other health professional. It really, like, the team is key, ensuring, and what a lot of at the American Diabetes Association is help to impart that knowledge and skills to different members of the team so that they can all practice to the best of their abilities.
Just listening to you, you'd feel like you're reading the standards of care from American Diabetes Association that usually emphasizes on the importance of diabetes team. You have to consult your diabetes team, not saying your doctor, but usually that is the context. That's how things are. Diabetes educator, psychologists, they are not seen as existent here, or even a dietitian. A doctor would even discourage you to say, hey, you only need to listen to me. You don't need to listen to anybody else. But a team strikes a balance in diabetes management.
Absolutely. A newer health professional in the US that probably has sort of very similar role around the world are community health workers. We're realizing that they're critically important as well, particularly to address the gaps that exist in care, that the inequities in care, the disparities in care. Having someone that can reach people in the community is really important. That's another important member of the team.
Thank you so much. We, as people living with diabetes, we greatly appreciate your involvement in the development of the better patient communication tools. And I believe these are covered in depth with what you created, what you call the patient-centered medical home, the PCMH model. I don't know if you could maybe break down what this model is and what it means to you.
So it's an area in the US. First of all, there's a recognition that, at least in most parts of the world, the vast majority of care for people living with diabetes is by primary care providers. And so we've increasingly pivoted to really focus on that community. In the US, they are responsible for 90% of the care for people living with diabetes. So we need to empower them with the skills, the knowledge, and then how to organize care. And the patient-centered medical home is an effort to organize care around the patient, have a number of capabilities within the practice to ensure things like team-based care, things like if somebody's not seen their healthcare professional for a while, to do outreach and remind them to come back in. If someone's not doing well, see them more often and be able to track this. You know, many of them they sound obvious, but if you look at most practices, they're not organized in that way. And so really sort of spreading that better model of care as broadly as possible.
Maybe a bit of a follow-up question on this would be like, why do you think patient-centered treatment is important for diabetes management? And I know I want this to help also the healthcare professionals, maybe I would say the junior healthcare professionals and researchers.
You know, in diabetes, it's probably the poster child for why, because, and this is what healthcare professionals at first don't think about, is that the time we as healthcare professionals spend with our patients is a very tiny part of their life, right? And what will dictate how they do with their diabetes is all of the time when they're not with you. And so it's really helping them to help themselves. Some of this gets back to sort of communication style. So there's a lot of research to understand what can influence an individual's behavior. Turns out that just telling people you must do the following things really doesn't work. For most people, they become resistant. They think of reasons why I can't do that, right? But if you ask people questions and you guide them as opposed to being directive, you guide them, what could you do to improve your health? And they come up with a plan, so much more likely to happen. So really, that's part of this patient-centered approach. It's really meeting the patient where they're at and what are they ready to do and how can I help you do that?
Having people to dictate, to participate in things that should work for them, it will be easy for them to implement and even to follow up. It's really great to see healthcare professionals, or also you encouraging healthcare professionals or the future healthcare professionals, because I know you also teach them to say, hey, you need to be a guide, not a gatekeeper, to say, hey, you're not doing it right, you didn't do this. So what really works for you? What do you think works for you?
Exactly.
So we as people living with diabetes, we greatly appreciate that. This is what we want to know. This is what we want to hear. I wanted to ask, why is funding important for care transformation work? And what has been your secret to success in receiving funding for the work that you do?
For better or worse, for a lot of interventions that are going to improve care, you need staff and other people to do the work. You do need funding. I think for those that are looking for funding, I guess what I would say is it's really learning to tell a powerful story. And that story probably has certain elements, what is the problem you're trying to solve, your approach and how it is unique. And often, I think the third component is something about why you. Why should we believe that you can solve that problem? Early in one's career, it's a little bit of a leap of faith, and that's why a lot of our research funding that ADA offers, we like to focus on junior individuals amongst our portfolio because it is more of a leap of faith. As you go on in your career, then you have experience of having completed successfully projects, and that makes a big difference. So it's that combination of the problem you're trying to solve, the special way you're going to do that, and why you can actually do it.
This has been amazing and enlightening. And I believe it will be inspiring to so many people that would watch this. For diabetes management, things should not really be generalized. So I don't know if you could maybe try to enlighten us more about the standards of care. Who really are they meant for, and can they be used worldwide?
The standards of care are really the most widely recognized guidelines around diabetes care in the world. It's this incredible group of individuals of different parts of the diabetes ecosystem. So not just endocrinologists, but nurses, kidney doctors, cardiologists, psychologists, dietitians, really the whole ecosystem that look through all the evidence, what's been published in the last year, then makes recommendations about what the standards will be. And it covers really from children to older adult for all of the different potential complications of diabetes, behavioral issues, diet. I mean, really, it's very comprehensive. I mean, in many ways, it's a yearly published textbook of diabetes. What we've been doing more and more is taking that vast knowledge and making it more digestible for people, because not everybody has the time to read a whole textbook. And so that's where infographic, short videos for healthcare professionals, we have an Institute of Learning that is free, and you can access courses. You could think of it as ADA University, and courses in different areas that can help people, healthcare professionals, become better. And then we're increasingly translating this information for people living with diabetes and their caregivers so they can be empowered to know what they need to do and what they need to talk to their healthcare professional about.
Incredible. Thank you so much for shedding more light on this. I don't know if you noticed, like how many downloads people make each time you publish the standards of care. You're going to have so many people downloading this because we are talking about them now.
Yeah, no, thank you. As I said, we're finishing this up, and so it'll be released in the coming weeks, and we get more than 2 million downloads as it comes out, and a lot of great coverage. We're excited to release, and there'll be a number of new and important changes that people should stay tuned for.
We would say it's music to my ears. Thank you so much. Dr. Bob, I know you're not just the person who is just sitting in the office. You do a lot of work. You're still involved in research. You're still teaching people, working with the American Diabetes Association, helping so many people. And also there's an initiative that you do, the Ask Dr. Bob initiative. You can maybe share with the audience what Ask Dr. Bob initiative is all about, where you are tackling a number of topics. I've seen there are a number of topics such as type 2 diabetes prevention and treatment, blood pressure, cholesterol, latest progress on a cure, and etc. There's so many things that you're focusing on. If you could maybe share with us.
No, thank you. I started this when I came to the American Diabetes Association, and it's an opportunity for people to ask questions. We usually have a theme each month, and we can always follow on the American Diabetes Association website and through social media. We advertise when the next one is. As I said, it's monthly. We have different themes, and it's really explaining things about diabetes in the same way that I do with my patients. I still see patients at Joslin, and it's sort of born out of that experience and the ability to share that through this video, just far more broad, extend the reach. So as you said, there are different topics and you can find them all on YouTube. The other place to learn about what's new in diabetes and lots of resources beyond the American Diabetes Association website, which is diabetes.org. I post a lot on LinkedIn in particular, also whether a new study comes out and here are the results, or programs that people can participate in, or all sorts of things, and sometimes funny and goofy things just to have fun with the world. And Ask Dr. Bob is on there as well. Lots of ways to learn more, and feel free to follow me on LinkedIn and hear about the things that are going on.
Let's just pretend this is Ask Dr. Bob program. What can you briefly tell us about some microvascular and macrovascular diabetes complications? And what are the ways to avoid diabetes complications?
Yeah, great. Well, this could be a long topic, but I'll keep it short. So they divide sort of complications of diabetes into those two categories, microvascular and macrovascular. And the reason they use those words, micro means small or tiny, and macro bigger. It's what kinds of blood vessels are affected. So the microvascular complications are eye disease, kidney disease, nerve damage that can lead to amputation. Those are the main ones. And the macrovascular usually refers to cardiovascular disease, heart disease, and stroke. And all of those are increased as a result of diabetes. The good news is that all of those can be largely, in many cases, prevented. And how do you do that? We use the simple thing of ABC, A1C, which is your 3-month average of glucose, getting that into a healthy range. B, for blood pressure, having your blood pressure less than 130/80. So that is a lower number than for other people. So blood pressure less than 130/80. The C is cholesterol, and having cholesterol in a healthy range. And so, for example, for people with diabetes, that range is than the average person, because we know that people with diabetes are at much higher risk for cardiovascular disease. And many people with diabetes need medication to get both their cholesterol and blood pressure in range. So it's the ABCs, and then it's catching complications early. And that's getting your yearly screenings of your eyes, urine and blood tests for your kidneys, and checking your feet for any loss of sensation. And so all of those things together make a big difference. The ways to get there depends on the person.
This was just amazing. So maybe the last question, this was not even part of the plan, but I just want to ask, because I know that you attended the ISPAT 2020. You said this was your first conference attending ISPAT. What were your key learnings from the entire conference? I know there are some sessions that you shared yourself, but from your perspective, what you learned.
So the ISPAT meeting was really exciting. I normally hadn't attended that, so it was great to sort of be in that pediatric and young adult diabetes world. I think the exciting things were continued things related to technology in diabetes that just continues to advance, and some of the tools that we have in adults are now being applied to children, automated insulin delivery and those types of things. So I think that was an exciting theme. I would say the other big theme was the excitement around being able to delay the development of type 1 diabetes. Now we have new therapies that can do that. That's the first step. So now, how do we find those people that are at risk? How do we administer the treatments? There's a lot to be figured out there. And so a lot of good discussion around that. And then an issue that really is a very big issue in the US and a big focus for the American Diabetes Association, but really is global. And that is that in any group of any population, and I'll use the US as examples, there are people that do well with their diabetes And then there are the people that are not doing well. And there's a big gap there. And those people that are not doing well, they are often lower socioeconomic status. In the US, we know that Black, Hispanic groups, and Native Americans all are at increased risk for diabetes and poorer outcomes, and trying to understand how we can narrow those gaps. And those populations that are doing worse may be different around the world, but there typically is sort of people that do well and the people that don't, and how can we improve the outcomes of people not doing well?
I don't have words to thank you, but all this that you've shared, the wisdom, the knowledge, the inspiration, this all has. So thank you so much for sharing with us. So I don't know if you have any last words to the diabetes community. And by diabetes community, I mean from people living with diabetes, healthcare professionals, and also caregivers, and even researchers. What would be your last words?
First, big thanks to the healthcare professionals and scientists and researchers that are doing the work to help people living with diabetes. And then to people with diabetes, we know it's not easy. There are many of us, and in particular the American Diabetes Association, we're committed to improving your lives. And we work as hard as we can to do that. We're making progress, but clearly there's more that's needed. So take care of yourself, and be well.
So thank you so much.
Thank you, Tino, and thank you for doing this program that really helps to sort of engage people living with diabetes and those that care for them around the world. I think you're doing a wonderful service by having this program.
You make it possible. So it's always great because people will be interested to find who are the people that this program is bringing to the table. And if people see people like you coming on, well, they'll be interested and they would want to keep listening. So yeah,